Depression is a psychological disorder that is described by debilitating feelings of negativity and sadness. It is believed that 17% of the population will be affected by depression at some point in their life. Major depressive disorder is the most common of depressive disorders. The DSM-5 criteria for major depressive disorder include depressed mood or loss of interest and pleasure for at least 2 weeks. Depression that lasts more than 2 years is labeled persistent depressive disorder. The discovery of antidepressants has been by pure accident. While researching treatment for tuberculosis in the 1950s, doctors realized that the drug ipronoside inhibited monoamine oxidase, which is an enzyme that breaks down adrenaline and catalyzes the oxygenation of monoamine neurotransmitters. Naturally, the inhibition of MAOs increased the levels of neurotransmitters involved with emotions, specifically serotonin, dopamine, and norepinephrine. The MAOIs were quite successful in treating people with depression. However, there was a glaring toxic side effect. People being treated with MAOIs demonstrated an increase of tyramine, a chemical that can provoke hypertensive crisis found in the bloodstream. Food products that include tyramine are aged meats and cheeses, yeast products, chicken liver, alcoholic beverages, and chocolates. A person taking MAOIs needed to seriously monitor their diet to risk heart attack or stroke. Another first-generation antidepressant was also discovered by accident. Imipramine, which was first used as an antihistamine and later antipsychotic, was shown to have a positive effect on depression. This drug became the first of tricyclic antidepressants. TCAs work by blocking the presynaptic transporter receptors for norepinephrine and serotonin. This allows for an increase of the neurotransmitters in the synapse, which elevated mood. Side effects associated with TCAs include drowsiness, cognitive and memory impairment, and life-threatening arrhythmia. Second-generation antidepressants kept their focus on increasing serotonin levels. The 1980s launched the prevalent use of selective serotonin reuptake inhibitors. The theory behind the effectiveness in SSRIs was to inhibit the reuptake of serotonin back to the presynaptic neuron. This elevates the amount of serotonin in the synapse. Since serotonin is considered the happy molecule, increasing the amount would increase the happiness. Side effects of SSRIs produce symptoms of insomnia, anxiety, and sexual dysfunction. A more serious side effect is a condition called serotonin syndrome, in which elevated levels of serotonin can produce neuromuscular, autonomic, and mental status symptoms. The problem lies in that it took several weeks for antidepressants to work. It has since been discovered that it is not the abundance of serotonin in the system that causes positive results. It is the neurogenesis of neurons affected by stress. Advokat, Comaty, and Julien report that antidepressants relieve depressed mood by acting at the cellular level to promote neuronal survival and reverse stress-induced neuronal damage. The effects of discontinued use of antidepressants depend on the severity of the condition. Quitting the medication will risk a relapse of the MDD symptoms. A 2-year recurrence rate is 40% after the first episode. The treatment of depression is possible without drugs through clinical therapy. However, the effectiveness of therapy would be limited in severe cases of depression. Thank you, and I hope you enjoyed the presentation.